Yeah, it's also about finding a plan, and that has been one of the great difficulties in this, because there is this split in the executive that is becoming clearer and clearer. Listening to all of this is Adrian Huston, who's a businessman and tax consultant, and also the Andersonstown News columnist Andre Murphy. Good afternoon to both of you.
Hi, Chris.
Adrian, if we come to you first, you're listening to this. Do you have a great belief that actually a lockdown will make a difference? You know, it feels like something has to be done, doesn't it?
Yes, I'm absolutely convinced, Chris, that a lockdown will make a difference. It will ruin our economy. The economy is in a terrible state at the moment. We are not seeing deaths going up. So, yes, we're seeing lots of healthy students testing positive. We're seeing lots of tests being done. We're seeing lots of positives. We're seeing 4 times more tests being done every day than in June. But we're still at daily deaths of 0 or 1, all the way from June. So these have not changed. So what's happening is people are testing positive, but most of them are not getting very sick. The vast majority of them probably don't even know they're sick. They're like the students. If we do this again, the education will suffer if they close the schools. Businesses will be devastated. A lot of businesses will not recover from this because the government support is not going to be sufficient. Take an example. Well, Stephen Farry, and I would just like to take this opportunity to thank Stephen Farry for voting against the extension of the Coronavirus Act in the Commons. He's the only Northern Ireland MP who did vote against it. But Stephen Farry clearly pointed out the problem we have is, yes, okay, if you take, say, hospitality, you might be able to protect workers in a restaurant with government support. But what about the people who supply the linens to the restaurant, who sharpen their knives, who supply food to them, who do all the services? They haven't been told to close, and yet their income might drop, to 0 or 10% of what it used to be. And there are all these wider impacts of a big lockdown, which are just not justified by the numbers of people getting seriously ill and, more importantly, dying. People are not dying. We'll get into the medical figures.
We'll get into the medical figures in just a second. But on that point of whether or not we can afford, from an economic and societal point of view, another lockdown, Andre Murphy, do you want to respond to that?
Well, I think that what we have to see now, I think what Gareth Gordon was talking about to you earlier on, but really took my breath away anyway. We're 10 days away from being overwhelmed, but we can see it and we know it. People earlier on were talking about schools not being the problem, for instance. We already know that the schools are closing. Full schools are closing, whether it's for 2 days or many of the pupils are being sent home for 2 weeks. Last Friday in West Belfast alone, there were over 1,000 kids not in school with classes having to close. There were over 100 teachers isolating. That was one constituency. So you put that right across the board, and we are seeing that there are parts of our society are already grinding to a halt without us having a proper coherent policy in place that is going to bring those figures right down. And I absolutely get what Adrian is saying, that there isn't a comprehensive and coherent strategy to protect and incubate businesses. There's no doubt about that. But it's a Hobson's choice right now that we know that the ICU beds are starting to be filled right across the island. And even in the south where the rates are lower, we are seeing that those ICU beds are becoming populated. And we know that in a few weeks' time that is going to mean that the mortality rates are rising. And people aren't trying to, the chief medical officers are not trying to close down the economy for some sort of academic exercise. They're doing it because our health is at risk. And I think that when you were talking earlier on to Chris Hazard about messaging, I think that the messaging probably hasn't been great, because we've been told from maybe August, the beginning of September, we're on precipices, we're at crossroads, and people were nearly deaf to it because at the same time life had begun to open up and we were seeing life beginning to look a bit more like normal. But right now, with those kind of figures that Gareth was talking about earlier, I think that we are now in a moment of emergency, and something very different has to happen. We can't put our head in the sand and we can't just wish it was different, because it isn't. It just is something that is very serious and we need to get our heads into it. And the messaging around not going to house parties, putting on your masks, we've had weeks of that. and it hasn't made any difference. Now we're into the thousands every single day of those tests coming back positive, and we know that those ICU beds are being populated. We are in a state of emergency now, and we've no choice. We have no choice other than to do something very, very dramatic. And we have to make sure that there's incubation measures put in place for all of those workers, that they are protected and the businesses are protected as well.
Well, I want to pick up on that idea of a state of emergency because, you know, as you say, we do get these figures from the Chief Medical Officer, the Chief Scientific Advisor, that hospital beds are being taken up, that there is a real danger of the health service being overwhelmed in 10 days. And then we do also get these claims from the likes of Adrian that whenever you take a look at the death figures, they are still very, very low. Let's speak to Dr. Tom Black, who represents the British Medical Association. People are struggling to get this in their head. What is happening here? Is there a certain amount of a time lag in terms of the hospital beds filling up and potentially deaths? Or is Adrian Huston right in saying that people should be less scared of the virus this time round?
I think our big problem now is it's winter. We have been seeing far more cases. So in the northwest, which seems to be leading the way in terms of the second wave, we've had more cases of COVID positive in the last 10 days than we had in the previous 8 months. So that's a huge reservoir of infections now in the community. GPs have been really busy for the last 3 or 4 weeks dealing with that. Then there's a lag period in terms of when do you actually get severely ill, because the first week of the infection is like a cold or a flu. So you then have a lag period, and we're now starting to see the admissions going into hospital, and the GPs would triage them, sort them out mostly in the GP practice, then refer about 100 per day in Northern Ireland was the figure last week. It'll be higher this week into the COVID centres. They triage out most of those and don't send them into hospital. But as you can see, every 79 days the number going into hospital is doubling. We have 130, 140 in hospital with COVID at the moment, probably about 19 intensive care beds was the number yesterday, but that's them just starting to catch up with the GP workload. So GPs get it for 3 or 4 weeks, then the hospital wards will get it for the next 2 weeks, and then the intensive care beds will get it after that for the really severe cases. So we see this escalating. We know what happened last time, and we know that we're actually in winter as well. So in Derry over the weekend, we vaccinated 5,000 people in the schools with the flu vaccine, did the same the previous weekend. We'll keep vaccinating people because normally what happens is a lot of people catch the flu now and end up in hospital with pneumonia and in intensive care with pneumonia. There will not be the beds for those influenza patients.
And as you say, there are those winter pressures. But, I mean, Adrian, I don't know if you want to speak to Tom Black directly here, but, I mean, you are raising these questions about why death rates are remaining so low if the number of cases is rising.
Yes, I am absolutely. I mean, I'm obviously not a medical expert, but I have spent 35 years studying numbers, and we do have the World Health Organization's Dr. David Nabarro saying that the leaders should stop using lockdown as their primary control method. We've heard about, I think it was probably 3 or 4 weeks ago, our Chief Scientific Officer was saying cases are soaring. I mean, at this time, obviously, they were much lower than they are now. Cases are soaring. We are going to see...
And he was right. They are soaring.
Yes, but this was about 3 or 4 weeks ago, and he was saying, how we're going to see an increase in deaths. Well, it didn't happen. And I have no reason to believe it will happen in the future. You know, the deaths might go up a little, maybe to 2 a day, but we're not seeing anything like the rise in deaths that was reflected by the rise in positive tests. And of course, positive tests produce pressures for GPs and the COVID centres. But if we're worried about the NHS not coping, then we need to make sure that our Nightingale Hospital is ready to take the COVID stuff and leave the NHS to do the rest.
I suspect a lot of doctors will hope that you're right in saying that those death rates won't rise. But Tom Black, is that realistic?
Oh, I'm hoping Adrian's right as well. And, you know, I concede the point that this is mostly young people now. More than half the cases are under 40, the majority under 60. The problem we have here, Adrian, is that we're looking at seepage across the generations. And every time I go on the radio or TV, I say the same thing, which is do not visit your granny. Do not visit your aunt or uncle who are shielding or have asthma or COPD, because the seepage across the generations is the problem. The Deputy Chief Medical Officer in England this morning showed a graph of the northwest of England, because Liverpool, Manchester, the northwest of England is the other big area with the second wave, and they're showing seepage across the generation. So the young ones are going home and hugging their granny, and that just drives me mad. Please, if you're one of those young ones that's been socialising, even if you have no symptoms, don't visit your granny, don't hug her, and stay away from your cousins and uncles who are shielding or who have risk factors. That's the key to keeping a lid on this.